the end of my prepared statements, but as I said, I would love to field questions from any of you guys. Yes, ma'am.
Hi, I'm Molly. I was curious about your philosophical and moral views on contraceptive as a means for a woman to choose when she reproduces in her life. Thank you for your presentation.
Actually, Molly, you may be surprised to hear that I actually agree with you. I read what your sign said out there, and I think that this is a problem. Well, all of what we're discussing tonight it's beyond one simple solution. And I do agree that if a woman does not want to bear a child, there are many, many extremely effective methods of contraception available. And I agree, we need to be talking about those, but we also need to be talking with young women about safeguarding their sexuality. I mean, even if a pregnancy doesn't result, maybe it's just chlamydia, maybe it's a broken heart from giving oneself to someone who doesn't care for them. So I think that within the setting of this, all of this discussion, I agree with you that contraception has a role.
And then also discussing when she does want to have a child and what support systems are available to her, within her family and then outside of the family, within the community. I think is, as you were saying, that's helpful that she knows she is supported in a greater cradle of humanity, so to speak, when she does go through this life-changing event.
Yes, as a parent of 3 children, I can tell you it's the most rewarding thing I've ever done. It's also the hardest thing I've ever done. I mean, I'm not up here saying it's easy. And when I think, and I've cared for so many women that are just, they're alone, and and what a crisis, and how we as a society have decided that that's acceptable. I mean, I agree, we need all of community support, but we really, really need to be helping the young men learn how to be fathers. Because even, we save a baby, the mom is a single mom, she makes it through, it's hard, but that child has lost something not to have a father in his life. So again, we just, across the board, there's more that we can be doing, I agree. Yes, sir.
This may be more of a statement than a question, but you mentioned the economics. With 70% of women would like to have their kids, but the economic side of it, it's almost like we never will kind of curtail the abortion side if we don't help the economic side of things in our society.
That's a very good statement you made, because I've seen that as a political statement, pro-life people should advocate for these type of policies because they improve economics, and obviously we're not going to get into politics, but I would say that there are many women who say this is the reason I'm choosing an abortion, and yet at the same time, if you say, well, were you aware that there's this, here's some money, that many times they still choose the abortion. So I think a lot of times you can, and the flip side is you certainly see lots of poor families having lots of children, so it does kind of come down to priorities. I agree, I want to see every family do better economically, but sometimes there's a lot more going on than just finances that lead to abortion. Yes?
You mentioned how women in minority groups are particularly prone to abortion, and you kind of attribute that to the eugenics stance of their being encouraged not to. And I sort of disagree with that. I, as an education and sociology major, I believe that these women in these minority groups, the reason they are having more abortions is because they are disenfranchised. They don't have access to healthcare that we do. They don't have access to the education we do because of gerrymandering. Their school districts are poor. Their access to, here I wrote it down. Childcare is subpar. They can't even afford food without like food stamps. Not to mention that even on food stamps, it's not enough to cover prices with the way that they are right now. So I disagree that they're being coerced into abortions, and more that they don't really have many other choices. Because yes, people in poverty do tend to have more children, but that's because they don't have access to this education, and they don't have access to the healthcare that would help them prevent this pregnancy, such as contraceptive.
Yeah, I mean, that's an interesting statement, and I don't disagree with you that certainly those are all factors, but it does become sort of a chicken or the egg phenomenon. Yes, they're in poverty, but many times it's a generational poverty that's come from family breakdown and many things. And of course, we could talk all night, but we won't, about like maybe policy prescriptions for that. But I guess the question is, do they want to have their babies, and are they just in a situation where they just don't feel that they can because of what's going on around them? And that's what I would say, that we as a society and perhaps people on both sides of the issues could say, let's make things better there, so that women who want to have their babies can have their babies. As I mentioned earlier, I just think unfortunately this has been promoted as the solution to so many problems. But keep in mind that we had nearly 50 years of unlimited abortion, and yet these groups didn't do any better, despite having very high abortion rates. So yeah, maybe it took care of the immediate crisis that they perceived, but it didn't bring them out of poverty having abortions. You guys may have heard of a series of studies called the Turnaway study. Has anyone heard of those? Anyway, it's studies from pro-abortion researchers where they looked at women who got an abortion that they wanted and those who didn't, who were turned away because they were past the gestational age limit. And they made a lot of hay about the fact that, well, 1 week later, so-and-so, these were happier women or whatever. But when you follow them out over time, what you actually discover is that this all converges. Like the women, sure, economically, a woman who is a single mom and maybe has to drop out of school or, her finances are gonna suffer. But over time, they converge. So it doesn't solve that problem forever. It just maybe temporarily, keeps one more mouth from being fed. But, again, we have the ability, we have very effective contraceptions, the long-acting reversible contraception. We could be helping some women not be in that situation in the first place, and then for those who find themselves in this situation and want to give birth but need support, we could just do a better job all around and, making sure they get support. And like I say, I can't say it enough because it does break my heart to think about these children being raised by a stressed out single mom living in poverty. I mean, we all hate that, right? But what can we do to help these young men learn how to be fathers?
I definitely agree with some of the things that you said. I think instead of focusing more on less so like abortion in general, and more towards preventative measures before pregnancy, and then also those programs, like you said, after the child has already been born. Because I think abortions are an issue. There are definitely too many of them, but I do think that before we can have those comprehensive sex ed for everybody, especially for men, because they like to go and be with a lot of women, and then after birth programs, so that if a woman can't support her child, she doesn't have to put it into an adoption center or the foster care system. So would you just agree with me that we should focus more on those two aspects before and after, rather than the suffocation of abortion itself?
Well, I'm concerned about abortion because I'm an obstetrician and I know what that unborn life looks like. I care for him. He's my patient. I've been caring for 30 years. And there's over 1 million every year in our country. And the statistics tell us that many, if not most of those, are unwanted. So that's that's a human rights issue, that we are ending human life in our country many times, I mean, nobody in this room, but many times in a very cavalier way. I mean, obviously we care about it, you know, regardless of our thoughts, we're here because we're interested in the subject, but some of these girls get the pills and it's just, you know, so, but it's, we're ending human life, we're ending over 1 million human lives. I mean, that should make us all stop, pause to think and say, where did we go wrong? That we now have such a casual appreciation for human life that we are willing to do that 96% of the time for social, financial, non-medical reasons. I mean, there's a lot we can do. Those other things you mentioned, yeah, we should be doing them all, but for me, ending innocent, vulnerable human life is a big deal.
Yeah, I agree.
Why aren't we promoting contraception? Nobody ever talks about it. It's like abortion is the big thing. You get pregnant, whether you just have an abortion, that's the contraception. But, yeah, I know that's the contraception, but in my generation, everybody took a pill. I don't understand why that's.
You're right, because you see it on both sides, right? You know, the idea of abortion access when they're not actually, I don't know, great idea. Let's think about a male contraceptive, right? Because if I'm researching, you know, I mean, there's things that we could be doing that we aren't, but
Nobody talks about it.
yeah.
I mean, and why isn't the medical profession promoting that versus?
OB-GYNs do all the time. Yeah, we're all about effective contraception, but every contraceptive method can fail. So I think that's why, on the flip side of that, they want that as a backup. But in my ideology, let's do everything we can to prevent it. But we all know how human beings are created. If you choose to engage in the act that creates human beings, and you do create a human being, at this point, maybe we should think twice before we end that human being's life. Yes?
I think this is going to shock maybe everybody here. 7 years ago, I heard an incredibly compelling podcast from Dr. And they have a podcast with every economist, Dr. Tim Riker, explains the economic impact of contraception on society, and they have found, with complete 100% proof, that contraception only benefits predatory men. All contraception only benefits predatory men. So even in a marriage, the divorce rate of couples who use any kind of contraception is 50%. I met a woman who is not using any contraception, and she runs Psalm Body. She helps women. Okay, just yesterday, and she gave the absolute truth that she has 5 children right now, and she wants to have as many babies as God wants her to have. So she'll have 10 or 11 if she gets pregnant that many times. My own mom had 8, and we had a great family. I met a family who had 23 children. And divorce goes to 0 or 0.8% for couples that don't use contraception. They pray and they have the best sex without contraception, because sex is for babies and bonding. And when you put any kind of barrier, condom is a physical barrier, and the chemicals have been found to cause the man to leave the woman because it changes her scent, her pheromones, the birth control pill causes cancer, breast cancer, and the IUD kills women because it can perforate the womb, and it just birth control decreases the libido of the women. She doesn't even want to have sex. And I would encourage all of you in this room to go to cathmed.org, and they're a member of the group you're with.
Yeah, that's the Catholic, that's Catholic Medical Association, I think. And yes, what you just described, certainly I think that there is evidence for all of what you've said. Obviously, living in a secular world, we can't tell everyone they need to adhere to the Catholic view of the sexual act, but it is beautiful. So if you've never read it, it really does, like you say, prioritize the relationship, prioritize the communication. I think most Catholic couples don't, it's not that, oh, we're trying to, just get pregnant every chance we get, but there are natural ways of, they call them fertility awareness-based methods, where you avoid the fertile time. But the beauty of that is
six
that
days a month.
it promotes communication with the couple, and also periodic abstinence and self-control, which we can all use more of. But anyway, but
It increases the bonding of the couple.
Yeah,
It's periodic.
it's an interesting. Yes, ma'am.
Could you speak more to what you just said about the fertility awareness-based methods? Like, how difficult is that?
It's really not, and they've gotten kind of a bad rap, but they don't need to have a bad rap. So a woman is only fertile 5 to 6 days a month, and so it really and I've actually found many young women, secular women, who maybe are somewhat skeptical of pharmaceuticals and things like that. So I've seen on both sides, women are increasingly interested in this. They like the idea of something very natural, also using their menstrual cycle as a vital cycle, like a healthy woman has a healthy pregnancy is a sign of a healthy woman. So this is an opportunity for people to really understand their bodies. And so there's a number of different ways you can do it. There's an organization in San Antonio that's called Natural Womanhood that teaches students how to do this. But it really has been derided unfairly, because it can be a very, very effective method of contraception. And like I said, like you said, it really helps a couple to learn how to communicate. So it's not, not necessarily a bad thing, but it's, because of the world we live in, it's not going to be for everyone. But I have 2 children getting married within the next 6 weeks, and they've both taken the Catholic classes, and I'm looking forward to see how it works. I'll let you guys know if I have 6 grandbabies in the next 5 years. I'll be like, well, okay, that's right. It doesn't end up in a lot of babies, but we'll see what it is.
You might have to change how you do your talks.
Yes, ma'am.
I'm not sure what you're trying to articulate. You're focusing a lot on teaching men to be fathers. And what I hear in that is the woman needs someone to come alongside her. Is that a key to you? And if it's not a good father, in other words, you said you deal with a lot of women worldwide. Or isolated because they're coerced, or, very well. So if we can help men realize that they can be good fathers, good partners, that notwithstanding, if the man won't stay, what are your recommendations? And do you have statistics about other people coming alongside that woman just to help her? Can it be effective?
Yeah, no, I certainly think it helps. I mean, again, we're in a fallen world. We're not always gonna be able to restore, the relationship that may be best for raising children. But yeah, absolutely. I mean, pregnancy centers just do some amazing work coming alongside these women. Community support. I mean, there's certainly, I'm not saying that a woman, that there's not other things that we can do to help her, and that's you know, what I love about pregnancy centers is they're doing it so selflessly and just because they care for women, which is beautiful. Yes, sir.
Pregnancy centers, we have a couple of locally, but they're being ignored by the local press. They won't allow any sort of letters to editor to be published. And actually, it's lackadaisical, review of them. You can't get them to come out and even interview anything that they do. And it's in depth that they provide. With that said, how do you lobby doctors or obstetric departments? Will they be willing to understand what these pregnancy centers can deliver?
You know, that's kind of a loaded question because I think that we all recognize it has become so politicized that for a media that may have a pro-abortion bias to recognize and to highlight the good work that pregnancy centers are doing is kind of, you know, that's not their priority. You know, that's why they're ignoring you. But you know, I mean, how many thousands of babies have been saved? How many women have just had their lives turned around by pregnancy centers? The support and then the spiritual support that they give as well. I mean, they're absolutely doing great work. I recognize Colorado has a lot of animosity, and you know, I work with a lot of pregnancy centers in blue states where they're called fake clinics, and many times there's laws coming out against them, trying to shut them down. But in a way, it's kind of a backhanded compliment because it's saying we know they're effective. And so, I think that most people who consider themselves pro-choice are probably, they feel like women need this, and they feel like, well, we just want to give them all of their options. But there are certain people who really aren't pro-choice, they're just pro-abortion. I mean, there's just some women that they just don't want to see having babies. And so options like abortion pill reversal, options like a pregnancy center that can help those women, they are opposed to them because that's not, helping them with that particular agenda, which is really just that those women don't.
So how would you lobby doctors though? They're hesitant probably from what you said, Colorado law.
Well, so I've worked with one in San Antonio for 12 years, and they were doing free mental health counseling. And so my 20 partners who ran the gamut, certainly not, most of them were not pro-life at all, but I'm like, look, this center is like helping women with, these needs that they have. And so they all ended up referring to them. And so I think that, maybe just highlighting things that can be done that maybe aren't as, charged, but that most doctors would recognize a need for.
What's your credentials?
Well, that hasn't stopped a few people from coming after me, but anyway. But yeah, just emphasizing the good they do, and I think just taking the slings and arrows and recognizing that. This is a very emotional, contentious issue, and that I do think that when the attention is directed in such a hostile way to the good work that pregnancy centers are doing, that's just showing that we're doing something good. So anyway.
You get a question over here in the front.
Oh,
Did one of the girls have her hand up over there?
Yeah.
Okay. Right now in pro-life states, they criminalize physicians, and they target like the doctors who are performing abortions as far as like you wrote this new abortion law. But there are some extreme pro-life states that are pushing for criminalizing women up to the point of homicide, child abuse, stuff like that. What do you think the harms and the benefits could be of something like that getting passed at a state level?
I don't think we're at a point where we're going to see that happen. I recognize that there are abolitionist groups within each state that are loudly advocating for that. My personal feeling is twofold. I feel so many women are really the second victim, both because of the physical harms, the emotional harms, the mental health harms. But secondly, because the abortion drugs are so widely available and they do cause so many complications, I think that additionally threatening them with penalties means they're not gonna go to, I mean, they're just not gonna show up for healthcare and we're gonna see women die. So I think that, I mean, I understand what motivates that. It's the thought that this is a human life and I really mean it and it's murder. And so whoever made that decision to end this human life should be held accountable. But pragmatically, I'm afraid that would lead to more harm than good. But I don't know, it's a very contentious conversation for sure. You guys did a great job. Yes, sir.
You mentioned you got some of your information from European countries and how they've collected information on their abortion stats. Could you speak a little bit about the legislation regarding abortion in Europe and in comparison to what we have across the states? And do you think the states are leaning in a direction to be more similar to Europe or in a different way?
Yeah, I don't think, I mean, again, it's the rugged American individualism, and we have very contentious conversations about this that really were not had in Europe. So it really is more of a neutral issue in Europe. The only good thing I can say about that system is that it allows us to collect data so that we can really see how common complications are. But unfortunately, as you know, we're in a divided system where we have states, a lot of states, 21 states have laws trying to protect unborn life, and the rest of them, 29, are going so far as to remove anything that might make it safer. And of course, they've shield laws protecting their abortionists who are mailing drugs into pro-life states. But across, and in these states that are loosening any potential restrictions that they might have had, they absolutely don't want to collect any data. And so they are trying harder to obscure the picture, which is very problematic. But regarding what's going on in Europe, the fact that they pay for elective abortion for any reason, in the United Kingdom, 1 out of 3 pregnancies are now aborted. So this is, I mean, it's bad here, but this is what happens when you say, no judgment, neutral, we don't care, and we'll pay for it, is that you just end up decimating your population. 1 out of 3. So, yes,
I actually have one thing to say. You said that population is decreasing pretty much everywhere, and that is actually false. It is decreasing here and in places like Europe, but in Nigeria, for example, and in China, and in other places in Africa and in India, they are increasing and are, in fact, in one, I can't remember exactly which country, but one country in the middle of Asia is expected to triple in population by 2030. So I don't really think it's a population.
So what I'm discussing is the total fertility rate, which is the replacement rate. How many babies does a couple need to have in order to keep, and this is independent of external immigration, right? So if we're just talking about a country that is, static, 2.1 babies per couple. And it is the case that the vast majority of countries in the world are below a replacement total fertility rate. So yeah, I mean, there sub-Saharan Africa obviously is an exception. There are still more babies being born replacing, but it's China. They never got over their one-child policy. They loosened it up, and women still are not having babies. Korea, the total fertility rate is 0.7. So 2.1 is replacing 0.7. So really, kind of under the radar, while not a lot is being discussed, is that Japan. Do you know a little bit about what's happening in Japan? They have a name for, I think it's lonely death, because there's so many older people in Japan without any family to care for them that just die alone. So this is what happens when your demographics get top heavy. and you're not having enough children to support the older generation. I mean, this is kind of a neutral question, but it's a demographic question that somehow we seem to be largely ignoring. But it is the case. I don't know exactly how many countries, but it's definitely the vast majority in the world that are below replacement scale. Yes, ma'am.
Hi, so I guess I'm curious about, so if you have a patient or like specifically a demographic that does not have access to healthcare, especially today, or healthcare socioeconomic issues, and I understand that you're not like an economist or a sociologist, that you're a physician. If there's patients you stated that there are places located in inner city communities, specifically Philadelphia, DC. What are your recommendations for patients where labor centers are closing, where there are places that don't have access to socioeconomic support, who don't have people around them to help them instead of abortion? What would your clinical recommendation be for women that don't have that support system?
Yeah, I mean, the good news is every woman living in poverty in America can get Medicaid insurance to pay for her. And more than half of our deliveries are paid for by Medicaid. So the insurance is available. But the reason that maternity care deserts are happening in rural areas as well as inner city areas is a paucity of births, is the fact that they can't keep themselves afloat financially because not enough babies are being born. And obviously that's going to be sort of a self-fulfilling cycle too. I mean, I guess when I said that, my point was city governments, instead of prioritizing abortion and saying, oh, we're going to give all this money, we're going to loosen all these restrictions, and like Philadelphia, literally, inner city Philadelphia has 6 labor and delivery units and 7 abortion clinics. So, we just need to look and say, what are our priorities here? Because I think that is a role for government. If you've got L&Ds closing and you've got women who are at risk for bad outcomes because there's no obstetric provider within, I see this in Texas, there's a lot of rural areas where people have to travel a long way. That is something where our government can say, you know what, this is a priority to us to help reduce maternal mortality and take care of women, and then that's something that they could, come up with novel ideas regarding funding and also training and just making sure that the staff at these hospitals are able to deal with emergencies when they come in and all of that. But I think that's just, the point I was making is that's a priority issue. Do we want to prioritize letting women have healthy births? Well, let's make sure that they have access to a place that can give them good quality care.
This is going to be our last question.
Yes, ma'am.
Can I just add to that? It's not really
Sure.
a question, but so I'm the director of one of the pregnancy centers, and when we have ladies that come in that don't have a support system and they've chosen to marry, Medicaid does actually cover doulas, and we will connect them with a doula. So in addition to being able to use the birthing center, they have an advocate for them in, through their pregnancy and in delivery, and they even provide postpartum services. They'll go and clean their house and bring them groceries and cook their food. So there is a lot available.
That's excellent, and I'll just finish with that. To tell you that maternal mortality is not what people think it is. I think we all think, oh my gosh, that was some catastrophic event in labor, right? And maybe the doctor screwed up. That can happen, obviously, but that's only 1 out of 4 maternal deaths. Our country has a problem with maternal mortality, but we count it to a year after the end of the pregnancy. And so some of it is just women who are alone, maybe they've got 3 babies and there's no support, and they get sick. And there's nobody to tell them, you look terrible, you need to see a doctor. I'm gonna watch the kids, I'm gonna drive you. They're there alone. And so they don't come in until things are advanced. We have a chronic illness epidemic in our country, so a lot of it is women who just start out very ill, chronic hypertension, diabetic, obese, things like that. So a lot of that, and a quarter of maternal deaths are mental health deaths. So it's not, it's not exactly what you think it is. And hospitals, I think we're trying very hard to do a better job, to do a lot of drills and protocols and, work things out so that we do respond quicker in emergency. But a lot of it is just related to women who don't have that support. So I love that idea. I think, doulas visiting homes and just seeing what's going on. Again, mental health, if she's there and she's a substance abuser and, the kids are going to, a doula's gonna see that kind of stuff and bring them to the attention of somebody who can help them. You guys have been great. All right, can we please give a round of applause to everyone who helped put all of this together? Let's just give one more round of applause for Dr. Skopp for coming all the way out. And I just want to say that if you have had an abortion or you know someone who is thinking about it, we're not here to shame you. As Turning Point USA, we believe that life is sacred, and we believe that not only is the life of the unborn sacred, so is yours. God has a plan for the unborn's life, and He has a plan for your life too. And we believe, and we know that God created life inside of the womb for a purpose, and He created that life to be born. Just like He created that life to be born, He sent His Son Jesus to die for our sins so that you can have eternal life with Him. So, yeah, you can be born again just like if you have any questions or need prayer for anything, come talk to me, come talk to any of our officers, Austin in the back. Thank you guys so much for coming.